Hi there, my name's Dr. Karen Philbrick, and I'm the Executive Director of the Mineta Transportation Institute at San Jose State University. MTI leads 3 multi-university competitively selected consortia. The Mineta Consortium for Transportation Mobility, funded by the U.S. Department of Transportation, the California State University Transportation Consortium, funded by California's Senate Bill 1, also known as the Road Repair and Accountability Act of 2017, and finally, the Climate Change and Extreme Events Training and Research Program funded by the Federal Railroad Administration. Our mission is to increase mobility for all by improving the safety, accessibility, convenience, and efficiency of our nation's transportation systems. To that end, we take our responsibility to the community very seriously. Our work is built on accountability, diversity, equity, integrity, and of course, sustainability. As you may all be aware, January is Human Trafficking Awareness Month. Human trafficking is the fastest organized crime, is the fastest growing organized crime with approximately $150 billion in annual profits. The perpetrators of trafficking rely on the transportation network to recruit, move, and transfer their victims, and to move goods produced by forced labor into market. Therefore, the transportation industry plays a critical role in preventing and combating human trafficking, as well as providing access for many survivors trying to leave their trafficking situation and obtain aid to rebuild their lives. The Mineta Transportation Institute is proud to be combating this issue through research, workforce development, education, and technology transfer. Today's webinar seeks to add to that effort. Let's move now into our panel. Each of our panelists deserve a rich and lengthy introduction, but time precludes us from doing that. So I invite you to review their full bios online on our website. But let me give you just a few facts. We have Holly Austin Gibbs. She's the System Director of the Common Spirit Health's Human Trafficking Response Program. Holly oversees efforts to implement policies, procedures, and education that assist providers in identifying patients who've been impacted by human trafficking and in offering trauma-informed services. Now, very importantly, Holly is a survivor of child sex trafficking, and that perspective is so critical to today's discussion. She has testified before Congress and consulted with numerous organizations, including the National Center for Missing and Exploited Children, the U.S. Department of Health and Human Services, and finally, the Amber Alert Program. Thank you, Holly, for joining us. Next, we have Polly Hansen, a dear friend and the Senior Director of Security, Risk, and Emergency Management for the American Public Transportation Association, also known as APTA. In her current role, she coordinates with APTA stakeholders to develop transit security, risk and emergency management standards, and policies. Now, very cool about Polly Hansen, prior to this role, she was Chief of Police for Amtrak, where she led a national police department responsible for protecting over 30 million passengers and 20,000 employees on an annual basis. Polly, thank you for joining us.
Hi, Karen, and I'm saying hello from the Virginia Square Metro right outside of Washington, D.C.
Fantastic. Hello. Next, we have closer to home, Elizabeth Jesperson. She's the Organizational and Human Capital Development Manager at Santa Clara Valley Transportation Authority, also known as VTA. She's deeply involved in diversity and inclusion initiatives and has served on VTA's Diversity and Inclusion Strategic Committee for quite some time. In partnership with the Director of Policy and Compliance, Elizabeth manages the Not on Transit grant, which focuses on human trafficking, which also provides federal dollars towards eliminating human trafficking in and around the VTA system. That transit agency voice is also critical to this discussion. You can see I'm quite passionate about this, and I feel that we've put together just an incredible slate of experts to help educate all of us on this sensitive, terrifying, and deeply emotional issue. Rounding out our panel, we have Dr. Kezban Yaki Sokat. She's an MTI research associate doing amazing work in this space. She's also a professor of business analytics at San Jose State University. Her research focuses on using decision analytics and management science to alleviate human suffering in the areas of human trafficking, humanitarian logistics, and public health. Thank you, Kezban.
Thank you for having me.
Now, to set the stage before we get into our question and answer period, we're going to ask each panelist to spend 2 minutes talking about this issue from their area of expertise. I will call on each of you in turn to do that. Holly, can you please share your voice?
Hi, Holly Gibbs here. I am representing Common Spirit Health today. So Common Spirit Health is a national healthcare system comprised of hospitals and associated clinics across 20 plus states. And so the program that I lead at Common Spirit is called our Human Trafficking Response Program. So what I do in this position with a team of people is lead efforts to adopt policies, procedures, educational modules, and other resources that equip our physicians, advanced practice providers, and staff to identify patients who may be victims of any type of violence, specifically including human trafficking in that conversation, because many healthcare policies are missing that type of violence in their efforts to address various forms of abuse, neglect, and violence, and to equip our providers and staff to offer victim assistance to patients in a trauma-informed manner. So our policies and procedures apply to both acute and non-acute care facilities. And we have lots of resources available that we share publicly so that other healthcare systems can also implement, so that we can share what we've done so others don't have to recreate the wheel. We've been working on this for nearly 10 years now. We've vetted our policies and procedures. We have example policies and procedures out there and a human trafficking shared learnings manual, which I'll maybe pop a link to, to share some of that information with others.
Please do. And you just said something that really piqued my interest, that you're educating these service providers on the symptoms and signs of human trafficking. Can you share with us what 1, 2, or 3 of those would look like?
You know, I like to point out that we should be on the lookout for both risk factors and indicators of different types of abuse, neglect, and violence. So we should be thinking about all the vulnerabilities that can create, that affect both communities and individuals, and can create situations where people are more vulnerable to a particular type of violence. And then we should also be looking for indicators. So sometimes when we think of red flags, we may think of bruises or STIs or the patient history not matching up with the injury. Those would all be indicators that something is going on. But sometimes someone may be presenting with a medical issue that may not immediately indicate a concern. But if they have a variety of risk factors that make them vulnerable to a particular type of violence, we should be on the lookout and taking it further and offering education and assistance when it's appropriate.
So really a holistic approach, and your organization is sharing these best practices to help combat this issue while not recreating the wheel with additional work. You have vetted policies, vetted educational materials that you know are objectively addressing the issue. Thank you for sharing your perspective. Polly, let's turn to you.
Well, thank you, Karen. And, you know, Karen did mention that I was with the Amtrak police, but I was in law enforcement for 40 years. And of course, human trafficking is a crime. And it's right up there with drug trafficking. And so I really became passionate about combating human trafficking when I became the chief of the Amtrak police, which of course is America's railroad, goes to 500 destinations in 46 states. And then Secretary of Transportation LaHood and Secretary of DHS Napolitano went to the president of Amtrak, Joe Boardman, and asked Amtrak to train all their employees. So Amtrak was the first surface transportation entity to train all of its employees. And that may not seem like a big deal, but it was, because there's 20,000 employees, 18,000 of whom are union employees without computers. So we were really challenged to come up with a way to communicate that message to our employees, and it worked. And I can give you an example. We had employees in Florida who every spring knew there was something weird with the guy that would go north. He was always in the presence of young men who did not talk, make eye contact, have their tickets or ID. And so after they had gotten the awareness training that the Amtrak police created, they called their local detective. And in fact, when the gentleman's background was looked at, he wasn't a gentleman. He was somebody who had been previously locked up for taking liberties with minors. And because Amtrak's not like being Law and Order SUV, you got plenty of time going from Florida to Boston, where he was going. We were able to contact local authorities. So now I'm at APTA, where in 2020, DOT launched the Transportation Leaders Against Human Trafficking, which was an initiative to engage the industry leadership and agencies in awareness and education and looking at data and analysis. APTA signed the pledge. APTA trained our employees. We really recommitted ourselves to webinars, podcasts, conference sessions, a resource page with best practices on human trafficking. We highlight the FTA grant recipients like VTA, where we're going to hear from Elizabeth on their efforts. We partner with Truckers Against Trafficking and Busing on the Lookout. I will put links to those organizations because they provide free training. Because we know in transit that, of course, children account for half of those victims of human trafficking. APTA is also partnered with Safe Place, which is an organization that looks to try to support vulnerable youth. Because you'll have folks runaways and they come to a transit facility because it's open, it's secure, it's safe, it's well lit. And that's where sometimes predators show up and take advantage of people who are just spending time, killing time, looking for safe refuge, and they're victimized.
May Joe Boardman rest in peace. And thank you for sharing that information about Amtrak. I did not realize that. And your example of how effective that training was definitely caused me to get goosebumps, because I think the more we can relate to those examples, the more we understand the gravity of the situation. So thank you.
We had gals when the fracking was really big near Minot, North Dakota. And so gals were being taken up there because those guys had nothing to do but spend money. There was nothing to do there. They were living out of their cars and on Indian reservations and tents. And so we had a gal who had been transported from the south up there, saw the train station, broke away, ran in there and said, I am being trafficked. And the employees, because they had gotten the training, like, they weren't shocked. They were aware that it happened and they called the police. And you can't get any better result from that, from training your employees, because they want to help and they know something's wrong.
And they're on the front line. They're seeing what's happening. It reminds me in some ways of the See Something, Say Something campaign and how effective that is when we engage onlookers, frontline workers, and people across the board in combating these very serious issues. Yes. Elizabeth, let's hear from you and from VTA's perspective, please.
Well, as mentioned earlier, I am the manager of organizational and human capital development, which basically means I'm responsible for all training here at VTA. That includes training for professional development, as well as technical and maintenance training for both our bus and our light rail service. The training we do provide, of course, includes human trafficking training. In 2014, we actually took a proactive step to train all of our staff on the red flag indicators of human trafficking. And I am proud to say, similar to Polly, we have a story here where that training actually led to our VTA bus operator thwarting a kidnapping while driving a bus.
Oh my God.
Tim had actually just come to VTA a couple of months before, went through the training, and credited VTA for providing the tools which helped him through that situation. Not long after that, State Representative Ash Kalra introduced California State Assembly Bill 2034, which requires transportation agencies to provide at least 20 minutes of training to its new and existing employees who may interact or come into contact with a victim of human trafficking. We've been providing training. We have continually provided training to all of our employees since we first started in 2014. But we recently we are now required to provide a Transportation Safety Authority training on how to prepare, observe, assess, and respond to a terrorist or domestic violent threat, incident, or attack. We've enhanced our human trafficking training to now provide that with the TSA training so that our employees will go through the training every 3 years. So we're excited about that.
You just said something so powerful, 20 minutes. 20 minutes of training can save a life, change the trajectory of a life. And once again, I'm covered in goosebumps. I can't think of anything more powerful. So thank you, Elizabeth.
You're welcome.
Let's round this out from hearing from our academic and resident scientist. Kezban, please share your perspective.
Hi. First of all, I want to say that I am honored to be with these highly qualified experts. So as an MTI research associate, I have been fortunate to have done research on multiple United States Department of Transportation efforts on combating human trafficking, specifically in transportation. I have conducted a US DOT-funded research in understanding the role of transportation in combating human trafficking in California, which, as the name suggests, investigates the role of transportation in different stages of human trafficking for both sex and labor trafficking in the state of California. It specifically addresses the role of transportation of people as well as transportation of goods made by forced labor, and investigates the awareness, best practices, data, partnership, all type of things that you can think of. I have been also fortunate to be co-PI for our partnership with our local VTA on the FDA grant on Not on Transit. I am also the chair of Forced Labor Working Group and Analytics Working Group member for the National Outreach Survey for Transportation, which is the first ever United States Department of Transportation Human Trafficking Impact Award. We collected frontline data on human trafficking awareness and the directions from the transportation professionals, survivors, and service providers, which is going to come out this quarter or next quarter. So I have been fortunate to look at what are the different types of research on combating human trafficking.
Thank you so much. And we really applaud the work that you're doing on behalf of the Institute. It's just so important. So we're going to turn now to a framing question. Again, each panelist having 2 minutes to respond. I see that we do have a question in the chat feature and the Q&A, so please keep those coming. We also collected questions from our registrants in advance. So let's turn now, and I will be calling on each panelist once again, but not in the same order. So keep on your toes. You don't know who's going to be called first. Here's the question. What are the federal and state transportation agencies and nonprofit community organizations doing to effectively combat human trafficking? I think we heard some of this in the opening response, but please dig a little deeper and share a few more details. Let's start with Elizabeth.
So transportation agencies such as VTA are increasing their efforts to raise awareness, train frontline personnel to identify and intervene in human trafficking, and partnering with public nonprofits and law enforcement to increase the impact of all efforts. We actually partner with a variety of different organizations. We have law enforcement. Our sheriff's department is on site. We also work with, in our training specifically, the South Bay Coalition to End Human Trafficking so that we can make sure that all of our partners are involved. Karen mentioned that we also have an FTA grant, which we're using to increase awareness, increase our public campaign on our vehicles. All our personnel have been and will continue to be trained in combating human trafficking. And we have made human trafficking a consideration in how the public can use our digital resources to quickly report information. We have an app that specifically you can click on human trafficking to report that goes to our protective services and law enforcement. VTA also participates in our in our county's Human Trafficking Commission, ensuring we are aware of local events, statistic resources, and law enforcement efforts. As discussed earlier, at the state level, legislation requires all transportation personnel to be trained in human trafficking awareness and intervention and prevention. At the federal level, the FTA has a human trafficking and public safety awareness initiative with continuing education and resources. And the US DOT's Transportation Leaders Against Human Trafficking initiative continues to retain vitality and provide resources to transportation agencies. Our current grant, we do have a $350,000 grant that we are using to do things like wrap our buses, increase awareness for our VTA alert, get the message out as to how best you can report this. So it's not just training our employees from within, but also raising awareness to our writing public on how they can contact an agency and report human trafficking.
You know, Elizabeth, because I'm located in close proximity to you, I'm remembering when Santa Clara County hosted Super Bowl 50 at Levi's Stadium, and what a big part of the discussion human trafficking was surrounding that major event. And I'm wondering, when you talk about this app and engaging the public and what to look for, one, what kind of response have you gotten? And two, are you using social media strategies, including like TikTok and other sorts of interfaces that reach a younger audience?
So our marketing department does have a variety of different platforms that they're using. I will say that back in June, I was brought on to oversee the grant. And one of the things that we did find is that we weren't getting a lot of contact through our alert. Very few, and what we had, what didn't seem to go anything. So we are really focusing our efforts on we're doing a baseline survey to see in the community who's aware of what. And now we're really going to focus our efforts on driving the public to this site if they should see a red flag indicator. So my understanding just from the other day is we are actually already seeing improvement in the responses that we're getting.
You know, based on what you just said, I have an idea, which is on an annual basis, MTI hosts an essay contest for middle school, pardon the siren in my background, for middle school and high school students designed around a specific transportation topic to educate them and get them thinking. And it may be age appropriate and time sensitive to address human trafficking within that space for our theme next year, because I think it's important that we educate our youngest citizens on what's happening so they too can be responsive. So thank you for that.
I don't disagree, and perhaps Kesban and I can talk a little bit further about that. And I completely agree. The younger you get them, I remember when I was younger, it just recycling, right? Nobody used to recycle a can. So they said, let's show them how to recycle when they're just starting school. And guess what? All those folks grew up and now we recycle. So the same applies. You can't start them early enough.
That's right. Well, I look forward to that partnership and to creating some good, well-informed young minds.
But
Holly,
Karen, I think more importantly, I think going back to, Holly's experience is that if 50% of the people who are trafficked are youth, then having an essay contact then allows people to understand that they're vulnerable as well. And so to describe some of the behaviors that, people use to invite people. And in fact, Truckers Against Trafficking and Busing on the Lookout, as Holly mentioned, and I had put their information in there, provides free training and has survivors. And one of the survivors mentioned, there were two. One that she was waiting for a bus, had missed the bus, and her father was going to be angry. And she was used to having a job, standing outside this particular pool hall, and somebody chatted her up and then started offering her rides. And that was the beginning of that. And then, another survivor talked about the bus driver. She'd gotten away from the traffic. It was raining. She had one shoe on. She was in the shelter. Bus drives up, bus operator says, "Can I give you a ride?" She says, "I don't have any money." And because the current she had been using was sex, she said, "And I'm not going to have sex with you." And he said, "Get on, I'm going to give you a ride." Offered her his lunch because he could just tell there was something wrong there. So certainly FTA, gave out over $5 million worth of dollars in grant money to have programs like VTA does. And, they mentioned they got hundreds of thousands, somebody got $1 million, other people only got $30,000. And so if you go back to, you only have 20 minutes to train your employees, it's not hard to do. And I know that because I had to accomplish that. DHS has a great program. FTA has a wonderful video that's transit specific that shows you how you can be a bus operator, somebody riding a bus, and overhear people talking. You talked about the Super Bowl. DHS does go into communities and offers a lot of training to hotel workers, Uber drivers. Heard the story here in DC where the Uber drivers driving the girls and they're going to a hotel because they're there to be trafficked. And then he called the police. So I think that people inherently sometimes know something's wrong. Going back to your see it, say it. It's the same thing, really. You're just giving people some indicators of strange behavior and then encouraging them to call. And particularly if people can be anonymous, which they can on many of our systems and apps and texts, they don't have to identify themselves and they can just report the behavior. And it's not a person, it's not what they look like, it's what they're doing or what they're saying. It's the behavior that's alarming and sometimes very telltale, like the person on the train. The kids never had access to their tickets, never left the roomette, never spoke to anybody, made eye contact. And somebody just thought that was very, very, strange. They knew that was just one right. So I do think there's some fabulous federal programs and out of other organizations like, Busing on the Lookout. They provide training to law enforcement for free, and they're particularly interested in doing transportation. And so if anybody's looking for that, happy to, connect you with somebody. Sometimes they'll knock on somebody's door and say, "Hey, we know there's going to be this event in the city. Really like to go down there and provide some training." You better believe that there's been all sorts of resources from the federal government made available in Phoenix where the Super Bowl will go. And of course, you don't have to have a Super Bowl, but there's reasons why trafficking happens there. But we know that trafficking is happening every day in our communities right underneath our noses, either sex trafficking or things that Paul will talk about, other people in your nail parlor, people who are, cleaning, that aren't being paid and aren't free to go where they want to go. So, but there are great programs.
Thank you for that. Thank you for helping flesh out those details. Holly, can you weigh in?
I was going to speak to the importance of having a program like we have in healthcare systems. But I'm going to pivot a little bit based on one of the questions that I'm seeing posed in the Q&A box around how to approach someone if you suspect they may be a victim of human trafficking. So let me share a little bit about our policies and procedures at Common Spirit Health as a way to share an example. So when we first launched our program, we launched it with and this is going back nearly 10 years. We launched it with the idea that we needed a list of questions in place to be able to ask patients so that we could determine if they were in a situation of labor trafficking or sex trafficking. And over time, we found that people who were experiencing some type of violence, including human trafficking, were very unlikely to answer questions, no matter how well designed they were. There are many reasons why a person may not disclose that they're experiencing violence, such as human trafficking. They may have fear of their abusers. They may be fearful of authorities. They may be in a situation where they view that this is their only alternative. They may not know what else is out there for them to access. So they may not even be able to envision a different option. There's many reasons. And that's a component of being trauma informed. So whatever policies or procedures or practices that you implement to try to reach potential victims should be trauma informed. And so year after year after year, we debriefed on cases at Common Spirit so that we could talk through what was working and what wasn't working. And what this ultimately led to was a realization that instead of trying to get the patient talking, our goal was to get our staff talking to patients about different types of violence, including human trafficking. So we were looking for ways to normalize conversations about violence, including labor trafficking and sex trafficking. So this varies from creating survivor-informed posters in our healthcare settings to create outreach to potential victims. And those posters are not creating images of exploitation. They are showing images of what is possible if you leave a situation of violence. So instead of showing, a young girl leaning into a car and taking money, it shows a young girl with wings saying, are these things happening to you? That was happening to me. This is what I gained access to because I asked for assistance. We also created a tool called PAIR, PEARR, that describes 5 steps to walking into a room and talking to a patient about violence if we suspect that person may be a victim. So it stands for provide privacy, educate, ask, respect, and respond. So in a private setting, we educate the patient in a normalizing manner about whatever types of violence may be of concern. And if we still have concerns, then we directly ask the patient, hey, now that we've had this conversation, I'm actually concerned about your safety. And this is why, this is what I'm seeing. And then beyond that, it's up to the patient. We have done what we can to assist that person in that situation. We have planted a seed. Beyond that, we are going to respect this patient's wishes and respond accordingly, which includes mandated reporting if it applies. It doesn't always apply. It includes scheduling a follow-up call, trying to, continue to build rapport with the patient.
Holly, you have such a unique space in this discussion. As a survivor yourself, you're perhaps the most critical and unique of the perspectives. What's something you want people to understand about survivors of human trafficking and perhaps the roles that individuals can play in combating it? Individuals, not the system as a whole, but someone like me, for example.
I think there's many things I could say, but one thing that I'll say is if you're truly trying to implement a program or a practice or a tool in your agency or other setting right now, get connected to survivors. They can help inform what you're doing. And not just one survivor. If possible, reach out to an organization that has a collection of voices that can help inform what you're doing. I'll post a link to 2 survivor organizations that I know of that you can partner with in your efforts.
That sounds great. And then one last question before we move on. You talked about this different imagery, changing it from a girl leaning in to take money to a girl with wings, which for some reason is making me very emotional. Was that survivor driven? That change in imagery, the subtle
That was
shift?
completely survivor driven. I, as a survivor, proposed using a poster of a girl leaning into a car because that's all I had seen. And once I got a group of labor trafficking survivors and sex trafficking survivors to talk through imagery, we came to the realization that that's showing us what we already know. Why am I going to lead? This is not leading me to do anything. I need an imagery that's going to show me what's possible. And that blew my mind. And I don't know that I would have gotten that far myself as a survivor without my colleagues, without my peers helping me talk through the process.
Thank you for that insight. Now, we only have 22 short minutes left, so let me shift right to Kezban. Kezban, would you like to weigh in on the framing question before we get to the online Q&A?
Sure. So my fellow panelists already mentioned so many wonderful things. I will just add a couple of things from the policy side, at least, like we can think of the safe harbor policies, especially in a couple of the California, state counties, there are the safe harbor policies already in place. Some of them are already also trying to implement it. So if you are in any bus or like any other transit agency that you see certain emblems, it indicates that if you are in any danger, including human trafficking, you're safe in that buses or in those trains. And those are going to help you transport to the location where you need to go. So I think if we can increase the awareness of those as well, from the other public, that's great. And then, of course, as a researcher, I want to emphasize the importance of actually using data analysis and technology, because if something that also speaks so much to the Holly's point, we already know some of these. Yes, we can share, amongst each other, among the transportation personnel, law enforcement and others, but we can also learn more. Most likely, if we are talking about the perpetrator information or some driver information, so we can share among different modalities to see what are the different trends. And if we have a perpetrator, because most of the systems are not interconnected, if SP is seeing some trends in some type of transportation, if we can inform either law enforcement or other cities transportation, as well as other types of modalities, that is going to help us actually have a huge collective information about how perpetrators are using human trafficking, because we all know that this is an evolving crime. Traffickers learn, they implement new tactics. And we already know that like some of these things is like in the bus or the train or like in the stop. But what else is new? What are the common tactics that are being used? The sharing of that information so that we, as the anti-trafficking practitioners, to be able to respond. I think that is one of the biggest, other things that I should add to my fellow, panelists. And the other one is the partnerships. I think it was Elizabeth that mentioned about how important it's to actually be a part of a local multidisciplinary human trafficking task force. So I would like to see from the both transportation personnel or like other anti-trafficking organizations to be able to provide that perspective for transportation to be involved in local human trafficking task forces. So we all know how transportation is playing a role in their own community, and then we can respond collectively according to these learnings. Thank you.
That multidisciplinary approach is always so critically important to make sure there's no stone left unturned or idea not considered. So thank you for highlighting that. For those of you who have dropped questions into chat, I do see that Polly Hansen is answering some of those live. I'm now going to turn to the Q&A, so forgive me while I read, but I want to make sure I get your questions just right. Okay, here's from Dimitri Boone. Our library is situated near 2 Metrolink train stations. How would our staff approach someone if they suspect a person being a victim of human trafficking when they come inside the library and are too afraid to speak up or ask for help? Who would like to start with that response? Polly?
I was going to say Holly. I mean, I know from a law enforcement perspective, but I think it'd be different to hear from somebody who might have wanted somebody to contact them. Me, I'd write a note and say, hey, is there anything I can do? Are you needing some assistance? That's what I would do if I was a cop or an authority, but I'd be interested in hearing.
Me too. Holly, take it away.
Sure. Yeah. So I was trying to address that question in when I was speaking previously. I think that it would be helpful if the library or any public health setting had posters or other materials focused on education, especially if you're in an area that's a vulnerable community, and having them available in various languages is key. And then beyond that, have a protocol in place that you have vetted with your partners and with survivors, building on what's out there, what has been provided already, not recreating the will, but have a policy in place. If you think a person in your library or other public health setting is a victim of any type of violence, including labor trafficking or sex trafficking, what do you expect your staff member to do? They should have that guidance up front before the situation presents itself.
So another message about training, as well as making sure that you have visual elements that help people understand what help is available in multiple languages. Elizabeth, I saw your hand. Did you want to contribute?
I would just say too that since it is between some transportation stations, I would make sure that the library is aware of what transit does. They may not know that. I think it was said earlier that our buses are safe houses. So anyone can come on. We're going to do everything we can to help protect that person. And just knowing that, and in the library, maybe they say, you know, if you need to take the bus, you know that's a safe place to go. Just it's awareness and education.
Mm-hmm. Mm-hmm. Anybody else want to share any last thoughts before we move on? Okay. All right. Let's see here. Excuse me. Let me go back to open. Where can we find a list of red flags for things to look out for? Holly, you talked a lot about some of the training materials that you use in public health settings and others. Do you have a list of red flags that the average person can look out for and address? Which incidentally, moderators note here, this is all really suggesting how important it is that we be present for the moment that we're currently in, instead of rehearsing what we're going to do next or thinking about what happened in the past. Being present for this moment can actually save a life or change the trajectory of a life. Holly?
So I know red flag resources for healthcare settings. I don't think that's going to be super helpful here. Like the American Hospital Association has a poster listing 10 red flags that we often share amongst our hospitals to raise awareness among our physicians and staff. So I would look for a resource that is similar to your setting, like Truckers Against Trafficking. They may have some great resources around red flags and transportation settings. I don't know that for sure, but I see a lot of folks nodding their heads. So probably that's the case. And Paul just posted a link to the Blue campaign, which offers lots of resources to the public around awareness materials.
As does FTA, and I put their link in there. They have a video that shows scenarios. So somebody scrolls up through the chat box, they'll see where we have submitted resources that they can go to for that kind of information, Karen.
And panelists, thank you for answering in the chat and providing resources. I admit it's a little hard to keep up with the chat, the Q&A, and what's happening on the screen. So I'm behind the 8 ball there. Appreciate you having my back.
Karen,
Paul,
can I add one more thing?
Yes, please.
So U.S. Department of Transportation also has modality-specific resources. So if we have anyone who is interested in airlines, or if we have anyone interested in other modalities, that is also a great resource. U.S. Department of Transportation, Human Trafficking. I will put the link soon. Okay. Thank you.
And I have to move on now because we're nearing the end. Clearly, we needed 4 hours or a full day to really dig deeper into this issue, which is just amazing to hear all of your perspectives. But now we're reaching the end here. So I'd like to ask each panelist to answer this question in 1 minute or less. And some of this we've heard during the discussion today. But what can the average individual or someone who works in the transportation industry, but who's not directly involved in anti-human trafficking efforts, do to help protect their communities? I understand that we need to be vigilant, that we need to be in the moment, that we need to be watching what's happening and providing a safe space for people to get help if they need it. But do you have anything else that you would like to add to that? Anybody can jump in at any time.
Well, I would just say that at least on the training side, because every person can play a part in preventing human trafficking. But from the training perspective, I think it's really important that when you look at those red flag indicators, you apply that to the audience that you're speaking to. So maybe a red flag indicator is, and of course my phone's going to ring right when I'm talking, I apologize. Has a child stopped attending school? Well, if you're a bus operator and you see someone in high school, elementary school on your bus at 11 o'clock in the morning, that might be something where you're saying, why are you on a bus at 11 o'clock in the morning type of thing. So apply it to, in our case, bus operators, light rail operators. Has there been a change in a behavior? This person always comes to the bus stop with a particular person, gets off with a particular person. Does that change? That's what I think is important. Customize your training to the audience you're speaking to.
Very good.
And I think it's not one and done. So if you're that bus operator and you have a rapport with people, and maybe you want to strike up a conversation and the person doesn't want to talk to you, that doesn't mean that you don't try again, that you don't
Absolutely.
to develop trust. Because I think Holly was saying, there's a lack of distrust there. And so all of a sudden, I'm not going to scream out like I'm being trafficked, so I think you just can't give up. If your intuition is right that there's something wrong, then start to develop a rapport and see what you can do for that person over time, because it may not happen that first time. And I know that I was working the Super Bowl in New York. My partner and I were up. We're actually going to go to the Macy's and I'm sure they were in a fight about human trafficking. We separated them. I told the woman, I can put you on a train going anywhere you want to go. Let me help you. And she said no. It was very clear to me, based on what I knew, that was what was happening. I didn't have an opportunity there to go with her and intervene in her life, but at that moment, she didn't trust me. And so, though I could have taken her and put her on a train anywhere, she turned down my help. If I'd had an opportunity to see her again, would have taken another crack. So you just can't give.
So in this case, redundancy is important because people need to feel safe before they can expose what's happening to them. And Polly, you said something about intuition, and it reminds me of one of my favorite quotes, which is, trust your intuition. It's often based on facts filed just below the surface. And that can be an important key to understanding what's happening. Would anybody else like to contribute very quickly to that last question?
Since we're talking about training our staff, I would like to mention that don't think that survivors are so other than you that they may not be in your audience, meaning we are your family members, we are your colleagues, we are your community members. So if you're standing in front of an audience and providing education on human trafficking, know that someone sitting next to you or in front of you could be a victim or survivor themselves, currently or in the past, or they may have a family member who is a victim or a survivor. So think about that when you're walking into a room and you're about to talk about, heavy traumatic material. How are you going to create an atmosphere or an experience where people feel safe through that education? Because we had nurses self-identify during our trainings, and we were not prepared for that in the beginning.
And Holly, I think you personally exemplify that as a survivor yourself, that it can be anyone, anywhere, anytime, and to be gentle with our approaches. With that, I'm sad to say that our time has come to a close. Later on today, the video of today's session will be available, and you're free to download any of those reports or to refer to the links that were shared with you during today's discussion. I'd like to thank our panelists, Paul Chang, Holly Austin Gibbs, Polly Hansen, Elizabeth Jesperson, and Dr. Kesbon. You really educated us and enriched us, and we're so grateful for your time, expertise, and perspective. And finally, thank you to everybody who joined us today. I look forward to seeing you at the next MTI's Research Snap webinar, exploring the use of public transportation among older adults during the COVID-19 pandemic. This webinar is the first of a 4-part series of our Advancing Transportation Equity focus. Join MTI researchers in discussion on transforming equity in transportation as we reflect on some of the most pressing issues of diversity and accessibility in the industry as a whole and how to overcome challenges. Thank you once again. It's 12:01, and with that, we've come to a close. Have a wonderful day, everyone.